Hello, Namaste.
Namaste.
Can you please introduce yourself, please?
Namaste everyone. My name is Mausam Gurung and I'm from Nepal. Currently I'm working for a Nawajiwan project. It's been 2 years or almost 2 years working for Nawajiwan. And whatever today's information or answers that I'm going to give, it will be solely and truly based on our experiences working for Nawajiwan families.
Can you please briefly introduce Star Children and Nawajiwan and describe what they do?
All right. Star Children is a non-profit organization. It was established in 2004, and it was basically focused for residential care. But later on, like after 16 years, we felt that like worldwide institutional care has been downsizing. So, with the need of the child and as a child's right to live in the community, we came with the idea of outreach or the community program called Nawajiwan, and Nawajiwan in Nepali is called New Life or New Hope. So this is how like we came about this project, and the Nawajiwan project especially cares for vulnerable and needy children with their families living in the community, and we support their overall aspects, such as the main aspects are health, education, nutrition, and if needed, we also support the livelihood for the families to have a better life for children.
How does HIV affect a child's ability to access education and participate in learning?
Well, the main effect or the problem that might appear is the stigma caused attached with the health status. When like the child's his or her like health status is disclosed, then there will be a problem from the school and within the school. And apart from this, like there will be physical problems, such as most of the children with such health condition, they might have hearing problems or weakness. So in this scenario, like they might have low attendance in the school, and due to this like health problems, they might be behind other students. So in the long run, like there will be some like academic disbalance. So this is how like a child's ability will affect.
Are children who are HIV positive welcome and accepted in mainstream schools?
Well, this question is a very contradicting and difficult question to answer, because in our community, in our society, when you are disclosed, people hesitate to accept your health status. So there will be like discrimination and negligence in the schools or community. But what we practice is we do not disclose the child's health status. So children are easily accepted in the school. But then like if the scenario is completely different, then obviously like there might be some questions arising.
What is the outlook for HIV children who aren't able to access the education?
Well, in our country's situation, education is a very important. Education plays a very important role. But then, like those who cannot access the education, they've already been stigmatized from the community, and plus, like with the poor health and no access to education, they have like double and triple burden. So like this escalates and will be a traumatizing situation for these kind of children.
What are some of the barriers that would prevent an HIV positive child to access education?
Well, from our information or from our survey, what we have come, the first one is the economic status of the family. Second would be the literacy capacity and the understanding of the family. And along with that comes with the health and hygiene of the family, plus the behavior as well. And the least would be the family status in the community.
What role does children education play in changing the social stigma around HIV?
Well, the first one will be the self-benefit, because the children will be able to understand about their health status, and then like they will be more informative and educated on their medication pattern as well, and the intake of it. The other one would be they will be as a role model for their own kind of peer groups, or like outside their peer group as well. They can be a motivator, and they can help the change attitude towards this condition or this disease, which can further like help and speak for people like them. So this can be a very good thing for their community.
How does the Star Children and BTO support access to education and study for the children affected by HIV?
Well, BTO has been helping us a lot. First of all, like BTO supports us financially, and in terms of technically, they helps us with the planning and policy making, and plus like they helps us with special assistance and guidance. And when we come to the Star Children, we find the need of the children and try to implement the planning and policy and the guidance that the BTO has given to us. The other thing is like we advocate if there is some cases of stigmatization or some problems with like assessing the education, we advocate the children to access the education. So that is how we lobby children's education, a proper education from the community to get attached to the school. Thank you.
When our community supports and donates to BTO, how do they help your organization and children?
Well, it's like a light to enlighten, and it covers all the holistic aspects when the community donates to BTO for our organization, where it helps to reunite families, and it helps to have a smooth and stable future for the children. And we believe in the capacity, of the children. If they are given an opportunity, then they can become star in their respective field with new hopes for the infected children.
Okay, at the end, do you have any other words?
Well, thank you so much. Thank you everyone who are directly and indirectly involved with Star Children and BTO for helping excluded and deprived families in the community. And thank you so much for bringing smiles in the faces of vulnerable and needy children. Thank you so much from Nepal. Thank you very much.